Hi everyone, Rick here. Hope everyone's doing well today. Got a video for you on diabetes and exercise considerations if you are diabetic. Diabetes affects 4.7 million people in the UK according to Diabetes UK. It's a metabolic condition characterised by high blood glucose levels in the body. And I'm going to just cover type 1 and type 2 diabetes, although there are other types of diabetes out there as well. So type 1 diabetes is where the body cannot produce insulin itself and insulin has to be injected. Now insulin is a hormone that basically helps to absorb blood glucose into tissues such as fat, muscle and the liver to be used by the body. Type 2 diabetes is slightly different. It's characterised by insulin resistance, so that is where the body can produce insulin, but the insulin is less effective at its job. So in each case there can be high levels of blood glucose still in the body due to insulin not being able to either work effectively or be produced by the body in each of those types. If blood glucose levels are allowed to continue to rise, it can lead to other health complications further down the line, such as coronary heart disease, peripheral vascular disease, peripheral neuropathy, which is characterised by lack of sensation in your peripheries, mainly the feet and the hands, and retinopathy, which is damage to the retina of the eye, which can lead to sight loss. Blood glucose can be controlled through medication and also exercise. Exercise helps by increasing the sensitivity of insulin, so that just means that it's more effective in its job of absorbing blood glucose into tissues to use. It can decrease body weight and body fat. One of the main exercise considerations with diabetes is what we call hypoglycemic episodes. So that is characterised by a drop in your blood glucose levels. It can be quite of a sudden drop during exercise, and it can be displayed as shakiness, clamminess, loss of concentration, loss of coordination. So to try and reduce these episodes of hypoglycemia during exercise, it is important to eat before you exercise. Anything up to an hour beforehand is fine. Anything less than an hour and you will be exercising during peak insulin activity. So that's when the insulin is working to absorb that blood glucose into the tissues. So it's not advisable to exercise during that time period. So eat before exercise, leave an hour and then exercise. During exercise it is important as well just to have, for emergency purposes, a sugary drink or snack like the glucose tablets or a fizzy drink to have just there in case you do get any hypoglycemic symptoms during the episode, during the exercise. It is also important to eat after exercise just to make sure that your blood glucose levels haven't dropped into that low number where you can have hypoglycemic episodes. So if you do check your levels yourself, you want to be above 5.5 millimoles for your blood glucose levels after exercise. If you are below that, it's a good idea definitely to have something to eat to counteract any of those symptoms that might be induced from that low reading you have. The last point is to check your feet after exercise, before and after exercise actually, just for cuts, sores, any blisters, especially if you do suffer from peripheral neuropathy, so you might not actually feel these things during the exercise where you have cut your foot or you have got blisters from your trainer pressure as well. So always good to maintain good foot hygiene and health as well. Hope this video has helped. Again, if you have any questions about any of that, please comment and we'll get back to you on that. Thank you for watching.